As I said, she said, my name is Bevi, and I'm a gerontologist. And when I tell that to people, most people are like, so are you like a doctor? Do you work with germs? What's going on there? So what a gerontologist is it's basically an expert in the field of aging, so working with the senior population. That has to do with the social aspects, the medical aspect, the physiological aspect, the psychological and the mental aspects of aging. So that's just a little bit of my education and my background. And in my previous career, before coming in with Livpact, I was actually a social worker / care manager. And I worked for the state and county of Santa Clara County, which is in the heart of Silicon Valley. And we've been talking a lot about Silicon Valley here. It's really rich in resources, it's rich in wealth, but I was working for the low-income population, seniors over 55 that didn't have access to a lot of these resources. So that's kind of my background, where I'm coming from, and I will be talking a little bit more about Livpact later on in the presentation. So, all right, let's see if we can get this. Oops. There we go. All right, so understanding the numbers. What's actually happening with the baby boomers population? So every day, 10,000 people are turning 65. Just take a moment to think about that. Every day, 10,000 people are turning 65. Right now, there's about 48 million people that are 65 and older, and that number is expected to grow to about 88 million in the next 30 years. So it's almost gonna double. And the dependency ratio, a lot of times folks will talk about the dependency ratio, and what that means is people who are working versus most of the time people who aren't working. So folks that are over 65 compared to those that are in the workforce, 18 to 64. So right now, for every 60 people out there, for every 100 people out there, 60 of them are over 65 who are not in the workforce. In 30 years, that number is gonna go to 76 people for every 100 people that are in the workforce. So it's a lot of people that are dependent on other people. And then you think about this, who's caring for these people? Yeah, they're over 65, but we all know as you get over 65, 75, 85, your health needs change. And with those changing of health needs, you need a lot of care. So what does the ecosystem look like? Who's taking care of them? Right now, there's about 45 million informal caregivers in the US, and that's about 20 hours a week of care. And there's about 4.5 million direct care folks. These are people working in home care, assisted living, nursing homes. These are not doctors. These are just kind of the additional care that's happening outside of the house. So something needs to change. And what exactly is that change? What are we gonna do to increase that change? What are some of the obstacles that we have? Well, one of the biggest obstacles is the money. The people that are kind of in the home, they're not doing the clinical work, they're not doing the medical work, they're not really getting paid. They're getting paid minimum wage to do this type of care. So there's big companies that are doing it, and it's the companies that are making the money, but the direct care folks are not making the money. So it's not a very appealing job to folks that are just entering the workforce. So what we really have to do is think about how we can increase the efficiency of the people that are already working there to make it better. And also rely on community and social resources to do what we can with what we have. So when you think about a senior, or you think about somebody over 65 that has a lot of chronic conditions, that has a lot of needs, where are they getting that care? So just to take, a lot of people are like, well, you know, they can get home care, right? They can get care in the home. When you think about the numbers, that home care could cost anywhere between $16 to $30 per hour, So annually, and this is only saying 4 hours a day, so this person is still pretty independent. They're just getting 4 hours a day for 5 days a week. That's almost $24,000. $24,000, and they can start when they're 70. If they're living to be about 98, just kind of do the math. It's a lot of money. Well, there's a lot of assisted livings out there, right? You see one every few blocks, especially in the Bay Area. A lot of metropolitan cities, you're kind of seeing these buildings pop up where seniors can go and live. They're not cheap. The average rate is about $140 per hour But yeah, it's a residence, right? It's kind of like paying for your apartment. Well, annually, the cost for that is about $51,000. It's a lot of money. And then you have folks that need even more help. They need help with their medications. They might have medical devices that, insulin pumps and so forth, that they need a lot of medical care. And then you talk about nursing homes. Well, look at those numbers. For a semi-private room or a private room, you're talking about $100,000 per year. So you start that when you're 70 years old. Even if you have $1 million in the bank, it's gonna run out fairly soon. And this is, again, just for care, not for any of the other expenses that you may have, including your medications and your insurance and so forth. So that kind of really paints a picture of what's happening now and what's going to happen as we go forward. Formal care, I touched upon this a little bit ago. PHI, it's a national leading source for what's happening in direct care in the workforce. They're saying we need at least 630,000 more home care jobs in the next decade. So these are minimum wage jobs for folks that are taking care of people in the home. And traditionally, so far, the pool of workers that are doing this care are between the ages of 25 and 64. That population is only gonna grow by 1.9 million. That sounds like a lot of people, but think about that population, the people that are turning 25, 26. This is not the field that they're going into. They're not going into home care. They're going into the tech field. There's every other field out there but home care, basically. Usually home care is kind of the fallback. So we're having a huge, huge dilemma up ahead. So who is a caregiver? Now, if I can get a raise of hands, does anybody here think they're a caregiver? Got a couple? Good, good. Now let me reimagine that. What is a caregiver? What do you think of yourself? What do you think of when you think of caregiver? Somebody that's in the home taking care? Well, let me rephrase that. Is there anybody here that checks in on a parent, checks in on a child, checks in on somebody that's maybe disabled, even if it is 1 or 2 times a week, 1 or 2 times a day sometimes? Sometimes you're texting them. You might be coordinating care for appointments. You might be working with a doctor for somebody else. You might be helping them with their grocery shopping. It might even be a neighbor or a friend, not necessarily even a family member. Those are all caregivers. And I think that's kind of where the discrepancy lies. It's just people don't consider themselves to be a caregiver because they don't want that title. They don't think they are that title. I'm just helping mom. Or especially what we see in the older population is, no, this is my spouse. We, till death do us part. I've been with this person for 40, 50 years. Of course I'm gonna take care of them. I'm not their caregiver. I'm gonna just drive them to their appointments. I'm gonna help them take their meds. I'm gonna do their laundry. That's what I'm here for. I'm not a caregiver. And we see this day in and day out. But the truth is, they are caregivers. So this is one of my favorite quotes. It says, there are only 4 kinds of people in the world. Those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So if you think about it, everybody here is gonna be falling into one of those categories. So caregiving affects everybody. It doesn't matter the race you are, what age you are, where you're from, your socioeconomic status. It's going to affect you, whether you're rich, whether you're poor, whatever your occupation is, it affects everybody. So what's the problem here? I've been talking about the problem a lot. I will get to a little bit of the solutions, but what's the problem? Well, people are kind of pushed into the caregiving role without even knowing it. They might, just know that their parents are getting ill, they have more chronic conditions, and they're kind of helping them out here and there, and they're not realizing they're actually falling into this caregiving role. Or sometimes that happens extremely quick, it happens overnight. For me, it was my grandmother who was extremely independent. While she was living with us, she was kind of doing her own thing. One day had a stroke in the hospital, and all of a sudden when she's out of the hospital, everything's changed. It's never gonna go back to the way it was. And a lot of people do find themselves in that situation where overnight somebody's needing a lot of care and they're being put into this caregiving position. Family members are often left, also friends and neighbors are often left without knowing what to do. Somebody goes into the hospital, they're discharged, they're given maybe 5 pages of paperwork, 5 pills, here, good luck. Make sure you don't come back in 90 days because otherwise we don't get paid. So that's what's happening out there. And so how are they coordinating all that care? Well, that person has to step up. They might also be working. They might have their own kids as well, and they might have their own chronic conditions. So they have to step up, coordinate all these activities. Usually that's physical therapy. They need to get some DMEs into the home. They might need to get a wheelchair into the home. They need to manage a lot of legal and financial stuff if there's any kind of impairment that's happening with this, with whatever the reason was they went to the hospital. And they need to have a long-term care plan. Now, a lot of discharge planners will go over this with them, but that's usually just once or twice. They might be assigned to a geriatric care manager, which is great, but then again, that's only once or twice a month. Nobody's kind of in there day-to-day looking after these people. And there are a lot of applications out there that are for the patients. You know, you're gonna go home and then you can wear this monitor and then we're gonna check on you and you're gonna see if everything's okay. Or there's a lot of applications that we've also talked about that are for the hospital and the care system. You know, we're gonna monitor you, everything's gonna be okay. But what about the caregiver? What about the person that's kind of behind the scenes? Isn't the one that's getting the care, isn't the one that's giving the formal care, but informally in the background is kind of navigating the system and navigating all the paperwork and the legal paperwork and doing it all, not getting paid because that's just what they're doing. That's the caregiver. That's the person I'm talking about. So from here on out, when I talk about the caregiver, I'm not talking about somebody that's getting paid to do this. I'm talking about somebody that's just kind of thrown into this. So what do we do? As I said, I'm with Livpact, and my background is from social work. So what we're doing is trying to create a platform where all of this can happen, and we're in no way, shape, or form are we trying to do it for somebody, but we're just helping manage that to make it a little bit easier for the caregiver. It's a platform to do everything all in one place, which includes the medical, includes the social, the psychological, and I'm gonna talk about that in a little bit. So this is just our app version. We have a few different versions, one for the app that's a little bit friendlier, easier to navigate. We have the web version that actually does all the integrations, and then we have the voice version that's can be accessed by a formal caregiver or actually the senior themselves. They can say, hey Alexa, I took my meds today, and everybody else can, in the network, can get that information. So these is just kind of the platform of what we do. We can manage the daily activities right within our platform. You can say, these are the 5 things that the senior needs to do, and they can turn into a checklist. Different people can check off that they've either done it or going to help to do it. They can coordinate with the whole team. We understand that caregiving, while there might be one lead person, it's really a network of people. It might involve a social worker, it might involve a physical therapist, it might involve a church member, a neighbor, even Instacart that does kind of all fall into this to kind of take care of one person. So we have different logins for each person at different levels. We understand that maybe the family members are gonna get access to a lot of that information, but you don't want the neighbor getting into the medical information. The neighbor just needs to know, maybe for rides or events and stuff. So you can kind of section that out. We talked a lot about medical devices, and so we don't want to forget about that. As I said, I am the social worker, so I'm not going to talk about the tech side of things, but we do integrate with a lot of the IoT devices, blood pressure monitors, insulin monitors, weighing scales. So if the senior or loved one does have this, their information is automatically transported into Livpact, and it'll be, if on the checklist you have take your blood pressure, and the senior takes their blood pressure, not only is it automatically checked off, but it's also sent to anybody else that's reading it. And if it does happen to get too high, they can also send an alert to say, hey, you might want to check on mom, the blood pressure is a little bit high. Finding support resources. We often get, everything else can be managed, but it's the resources. I don't know where to go if I need to get a wheelchair. I don't know where to go if I need to get a new pharmacist. So we also have, within our platform, access to local resources, whether they're living in California, whether they're living in Florida, wherever the person is living, we can get access to local resources that fit their need. And we also maintain a complete health record. We can tap into about 95% of the EHRs out there, so when they go for a doctor's appointment, that information is automatically pulled into Livpact. So if the senior happens to go to an appointment with the neighbor, The son or daughter doesn't have to call the doctor and see how it went. They can log into the Livpact, look at the notes, see what the care plan is, see if there are any medication changes and so forth. And also for long term, we plan for the care journey. We're not meant to be, do it once and kind of forget about it. We really want to be there for the whole journey, so we can put in end of life care, power of attorney, and like kind of legal and financial things all within Livpact to go forward. Any questions? I went through a lot really fast. Yes, any questions? No questions. You guys all love the product. Oh, there it is.
Just real quick, what kind of feed do you have in order to keep the information updated on your local resources? Because those can change so quickly.
So we do extract, I believe, on every 15-minute basis in terms of getting information from an outside source, whether that's an EMR or a medical device. Of course, it's real time if it's something done within the app. But if you're talking from kind of extrapolating that information, it's based on an every 15-minute basis.
I was referring more toward the resources available at the local level.
Oh.
I thought you said like if they needed assisted devices or something like that, DME equipment, that type of thing. How do you keep that information? What's the feed?
Oh, I see. Okay. So we are constantly adding to that information. We also work with different organizations. So if they add something, we will actually check if it's a legitimate resource, and we'll add it to our main pool and main directory. And we're also connected to Yelp as well. So that's actually one of the different search engines that you can do. Just like somebody can add to Yelp, it gets accredited and it becomes part of the directory. We also do the same, a similar type thing. Yes.
So are you doing anything related to matching them with the right kinds of providers in that community, whether it's a nonprofit or?
So we stay away from actually, we'll give them a solution of, if they're looking for, say, a dentist or a home care agency, we will show them the top 5 or the top 10 based on ranking, but we won't say, go to this one specifically. We don't get a commission off that one or something like that. And we're actually trying to stay away from that because we believe it's better, whatever is better suited for that person and for their needs. But what we are doing is we are also working on an AI on the back end to suggest things that are based on the full roundabout view of what they need. So if that person has been having a lot of falls, they've been going to the doctor because they're falling a lot, we might be able to suggest maybe you should get a home health assessment done in the home to see if, is it something in the home? Maybe you should get a neurological assessment done to see, is there something going on, maybe with your medications as well, too many medications, polypharmacy going on. So that's something we're working out in the future, but not necessarily specifically for a certain service or a certain provider. Yes.
My parents suddenly couldn't live at home, and we needed to find a place, and I think this is quite common. And you may have an app, but the first thing you do is you go to Google. How do I find a solution, right?
Yes.
How can people do that today? How do you get started when you suddenly have about one day to find a place?
So, first of all, that's very, very common, and that's usually how people look at services. It's when there is a crisis, and that's when they need that service right away. So hopefully this, the family member will have this, and we have that information running for a couple of months to see what kind of lifestyle they're living. But if it does happen where they need that, there's a search function within Livpact where they can look at the top 10 assisted livings. Maybe they're just looking at a certain area. They want to see in Las Vegas, what are the top 10? Or maybe they want to see what are the top 10 memory care assisted livings. And we can also say, no, they're actually looking for somebody to walk them through. Well, here are the top 10 companies that kind of do walkthroughs or geriatric care managers that will help you get to the right place. So that's what we would provide to them instantly.
Anyone else? Please give a round of applause to Bevi.
Thank you.
Thank you so much for that talk.